Okay, Loretta, let's talk about teeth cleaning, hygiene, kind of like, the regular checkup type of things. What would you suggest should happen there? Maybe you include a little bit how and when and what to brush. A certain toothbrush is more important than others, better than others. Tell us a little bit about that whole thing.
Well, first of all, the number one thing that I would say about all of what you just said right now is consistency. Most people, I would say, they're already doing pretty much everything they need to do for their hygiene. They're just not doing it consistently enough. In other words, they have floss at home, they have the little picks, they have mouthwash, they have the electric toothbrush, they have the water pick, they have all the different paraphernalia. They just don't use it enough. Most people will brush their teeth very close to when they have their dentist appointment. They'll start a week ahead of time, or one day ahead of time. I would tell people you have to be consistent with your hygiene. You have to be just as consistent as the rest of your hygiene in your body. I like to alternate between a manual and an electric toothbrush. I always recommend soft bristles. I have a tendency that the older the patient is, the more they like medium bristles. And experience has shown me that the softer the toothbrush, the less abrasive it is to the teeth, the less damage there is to the gum. So as a personal preference, I like the toothbrush to be softer. I've seen that a lot of people have a tendency to gravitate as they get older to the sensitive toothpaste, Sensodyne, or other brands out there that address that issue. And they really never look at the different factors that are contributing to that. So flossing is extremely important. I always tell people only floss the ones you want to keep. It's very famous from a movie with the doctor that was a very sarcastic doctor, but I try to say it in the nicest way. But the truth of the matter is if we are flossing, we keep the dentist away. 75% of the bacteria are lodged in between the teeth and in below the gum line. So flossing needs to be done 1 to 2 times a day on a regular basis. I've found that most people will only floss on special occasions, on weddings, when they're going to church. I personally didn't learn the habit as a child. I had to learn as an adult, and I had to, have some growing pains like everybody else, have some cavities, have some problems with my gums. The most important thing is to work with your hygienist. Work with your dentist every 6 months, every 4 months, whatever they recommend, and be consistent about it. Most of the time, believe it or not, as a dentist, I get very happy when a person walks through the door and they have learned everything they need to learn and they're healthy. And I've found that those people that are healthy are the ones that are the proudest to say, that person is my dentist. Most people that have a hard time with their overall dental health have a tendency to really kind of put it off. I mean, a lot of people get overwhelmed with treatment, and they do a lot of treatment at a time, and they'll go disappear from the dentist 2, 3, 4, 5 years or 10 years, be the case. But consistency, that would be the number one thing. Consistency on whatever you're doing, no matter how well or how badly you're doing. If you're consistent, you're going to have good results.
Okay. Well, I have heard that dentistry, out of all the medical disciplines which we, know of and which we kind of like have divided the body in, is the most preventable of all.
Yes, yes. And that's the part that surprises a lot of people. A lot of people take for granted. They say, well, my father lost all his teeth, so I'm pretty sure I'm going to lose all my teeth. And there's so much information. I mean, there's so much information that you can get from reliable sources on the internet that will give you education. I mean, I always tell people, listen, I'm going to show you how to floss. But if for some reason the way I explain it to you does not make sense, you can go on YouTube, and there are some very good videos that will show you how to floss. If the hygienist gave you a technique and maybe it wasn't quite as clear, you can go on YouTube. You can go on Google, and there's different ways of finding all this information. The main thing the nice thing about it is that as a community, the dental community is very focused on people actually being healthy. And I don't think it gets mentioned enough that we put out so much preventive information out there to make sure that people have good dental health and good overall general health. and we're more than willing to give that information out. How receptive that you are as a patient, that's where the consistency of showing up with your dentist and making sure that you're consistent on having those checkups.
Wonderful. And that goes hand in hand with what we mentioned about periodontal disease and gum disease.
Yes.
You know, basically, this is where it starts. Floss, brush, use your mouthwash, do your things, and do your regular checkup cleanings, because then it won't really come all that easy to a gum disease in the first place. And all those little infections, you know, they're easily cleaned away, basically, right away.
Generally, people with healthy gums and healthy teeth live longer, and they live healthier overall lives. I've heard stats where they say that people with healthy teeth and healthy gums live 10 years on average longer than people with unhealthy mouths. How much time that is, if it's a little bit more, a little bit less, I would say if somebody told me, would you like to live 10 years longer? Yes. What do I need to do? I would pay attention to it.
Yeah, and most likely it's not just the 10 years, but it's quite a few times a year where you probably get less sick, have less, as we said, the immune system breaking down, and all that is also pleasant, right? I mean, if the life is more livable, if it's more alive, if it's less handicapping. Well, thank you very much, Dr. Garrett. Again,
thank you.
It would be wonderful, and we really should do what the doctor says, right?
Yes, please do so.
Okay.